The American Hospital Association, AHA, is committed to supporting and advocating for organizations that are tackling the opioid crisis. One of the ways AHA does this is through developing and highlighting effective strategies, tools, and resources to help stem the tide of the opioid epidemic. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer in AHA's Washington office, and your podcast host. This podcast will explore the Prescribe Safe Initiative, created by Monterey County law enforcement, the administrators of 4 Monterey County hospitals, and local physicians in response to concerns about prescription medication misuse in Monterey County, California. Prescribe Safe is meant to guide, educate, and provide resources for local physicians and patients in the safe use of prescription medications and promote safe and effective pain management. Today, Rebecca Chicky will speak with Kevin Causey, who as Chief Development Officer, Montage Health, is on the front line working to address the opioid epidemic.
Welcome to another in American Hospital Association's ongoing series of podcasts, where we learn about how clinician and administrative leaders are navigating pressing healthcare issues. I am Rebecca Chicky, Director of Field Engagement and Director of the American Hospital Association's Section for Psychiatric and Substance Abuse Services. Today, we are talking with Kevin Causey, who, as the Chief Development Officer at Montage Health, is on the front line working to address the opioid epidemic as part of the Prescribe Safe Initiative. Today, we'll be discussing how the Prescribe Safe Initiative secured funding and buy-in at the foundation and hospital level. Welcome, Kevin, and thank you so much for talking with me.
Well, thanks for having me, Rebecca.
To kick us off, tell me a little bit about yourself, your current role, and what drew you to the Prescribe Safe Initiative.
Well, I'm the Chief Development Officer at Montage Health, and my job is to run the Montage Health Foundation, which was set up 2 years ago to support the work of Montage Health, both within the system itself and to, more than anything else, springboard their community health initiatives, of which Prescribe Safe is a profound one. And we were drawn to it. The program had been up and running in its nascency at about the time that I arrived here, about 18 months ago. And it was clear that we were seeing some positive signs of success in addressing a problem that nationwide is difficult to show signs of success. And so right from the get-go, we thought that in many ways we were backing a really strong horse here. And we felt compelled to really lean in with Drs. Close and Grover to really help propel this thing forward.
Thank you so much. And for those of you listening in on this podcast, there are separate podcasts with Dr. Grover and Dr. Close. So I will give you more information at the end about how to listen to those as well. Thank you for that update in terms of, the initial growth and interest and connection between Montage Health's foundation and the Prescribe Safe Initiative. How did the foundation's involvement really impact Prescribe Safe? And what was the approach to securing funding? And what were the key considerations and challenges?
Again, this was a nettlesome problem that was impacting not just our community, but our organization directly. So it was what was going to be good for our organization was going to be good for the residents of Monterey County and vice versa. Meaning if we could reduce the impact of the opioid crisis on the community, by default, we were reducing the impact on the organization and our community hospital as well. So our hope was to be able to reduce unnecessary emergency room visits, unnecessary hospitalizations, and that kind of thing. And again, by default, that means that the county was seeing less and less of that kind of a problem. So we stepped in as a funder, as a backing, founding funder, if you will. We were making grants ourselves to Prescribe Safe and also organizing fundraising efforts to help them as well. And we thought about this very strategically in that if we wanted to raise money In this particular case, it probably would have been better off to raise small gifts from a large number of people rather than going to, say, a couple of large institutional partners. And the reason for that was twofold. One was to engage more people in this work so that they could be advocates out there in the community, but also to get as many people aware of the scourge and the impact and the level of it in a place like Monterey County, which you wouldn't think, just right off the top of one's head, that this would be a community that would be as heavily impacted by the opioid and heroin scourge as other communities were. We're a relatively affluent community. We're a vacation destination kind of community, and you wouldn't just think on first blush that was going to be a problem on a scale that it is for rural counties or elsewhere. But indeed, it is, like everywhere else. So we allowed Drs. Close and Grover to have some flexibility to be able to pilot things, to be able to try things. When they established a partnership with the police department or the county or something like that, they knew that they had the financial resources behind them to not just ask for a partnership, but to actually financially support a partnership. One example is in working with the police departments to make sure that every police car had Narcan in it as part of its standardized equipment. We, the foundation, paid for it, continue to pay for it. So we get bills from the various police departments to resupply them with Narcan. And so it wasn't Doctors Close and Grover go to the police departments and say, hey, we really think you should do this. They were able to go into those police departments and say, hey, we have this to give you. That's a very different way of approaching a partnership. Again, the fundraising effort, we started with Montage Health employees and made the Prescribe Safe program one of the key funding initiatives for our annual employee giving drive. And so it was the ability for us to not just raise money, but to send specific information about this program, about the need for this program, to over 2,400 people who had a key vested interest in its success. Then by default, they were advocates for not just this program, but for the general work in the community on this issue throughout the county. So we thought about being not just a funding partner that would just simply write a check, but how do we engage with the leadership of the program to be a true partner to help them really accelerate what they were trying to do, both on a macro level and a micro level.
That's so intriguing. You really approached the fundraising, at least one aspect of it, so that everyone had skin in the game. They bought into the value and the importance of the Prescribe Safe Initiative and then became almost individual marketers in a way. Are there differences, though, behind the thought process for funding and budgeting from a foundation versus a hospital or health system setting? And if yes, what are they? You noted that, you went to the individuals, employees of Montage Health, but share your thoughts in terms of the differences that may exist around funding and budgeting from a foundation versus a hospital or health system.
Well, to speak on behalf of the hospital, we're in a very fortunate situation at Montage Health where we have a very forward-thinking leadership base who is willing to invest and willing to quote-unquote, take a loss on a project if it does contribute to the overall mission of making Monterey County the healthiest in the state. That's our goal. And Montage Health is a system, not just Prescribe Safe, but a number of other community health-related projects that they're executing around the county. Cost consideration, meaning is it going to make money, not make money, break even? They aren't considerations. And that was also true with Prescribe Safe. They identified a very specific need, a very acute need, and here were two emergency room physicians that had a plan in place that looked like it could actually work. And so they backed Drs. Close and Grover right from the outset. The point of a foundation that is supporting a healthcare system is to step in then and take some of that burden off of the hospital and off of the system. And that's what we have been able to do. So Reb and Casey, Drs. Close and Grover, didn't have to continue to go back to the hospital, to Montage Health for funding for some of these initiatives, and especially some of these pilots that they were wanting to run. They could come to us. So again, in terms of having a program alleviate a burden on the hospital, the long-term, reducing the problem from the outset relieves part of that burden, but also having a foundation step in as a partner relieves a financial burden. So as a foundation, then, we are able to be more nimble. We are able to take more risk. We are able to allow our program to try and fail, learn from those failures. I think in a way that's a little bit more difficult for a hospital or a health system to do because they have so many other considerations on any given Sunday that we don't have. So I think that in the particular case of this program, I think it allowed Drs. Close and Grover to have a little bit more breathing room to think a little bit longer, deeper, more broadly about how to approach this.
Has your financial planning for Prescribe Safe evolved since you started, I think you said in 2014? Has it evolved and changed or just simply grown?
It's just simply grown. The beauty of the work is that the doctors went into this and they started the nascency and the idea started prior to my getting here. But a lot of my experience has been in community health and in building collective impact approaches to complex problems. And that's how they started. That was the seed idea here. The only way that this was going to happen is if they coordinated the efforts of a whole bunch of constituents in order to attack this problem in a unified way. By definition, by spreading the burden among a broader group of people who are agreed upon the nature of the problem, agreed upon the set of goals laid out, and agreed upon the strategy for solutions, that diffuses the cost, that diffuses the burden. And so the growth has been exponential, frankly, without an exponential growth in dollars that we're having to provide. Again, it's kind of a shared burden, if you will, and everybody's taking on the piece of it that is theirs to take. They all have parts of budgets that are also contributing to the overall effort. And so I would say our financial strategy was born from a place of efficiency from the get-go. And so it is, in many ways, becoming a self-sustaining engine, if you will.
One last question.
Mm-hmm.
What lessons have you learned that you'd like to share with the group?
Well, there is a way to actually reduce this problem in a community. It's funny because I've been in dialogue with various people from around the country in various parts of the solution grid, if you will. I've talked with other healthcare professionals. We've talked to people in law enforcement and district attorneys' offices. And in so many communities, what we've heard from folks are, we don't even know how to start. Like, we don't even know how to begin to attack this problem. So what I would tell people is, I'm not saying that we are the only model, but we are a model that has actually shown a reduction both in opioid deaths and a reduction in unnecessary emergency room visits and hospital admissions. We have the data that shows it. We are seeing a significant drop. It can work. It takes the whole community to kind of come together, organize themselves, and work together in order to do it. It can't be just a hospital or just law enforcement or just the courts, or it's got to be everybody working together. School districts, churches, and synagogues. It's got to take everybody coordinating their efforts and agree upon the need to do it. But if you do, it will work. It's not a mystery, and there is hope.
Well, Kevin, thank you so much for your willingness to share your expertise, your experience, your insights into obviously what has been an incredibly successful approach to impacting and reducing the impact of the opioid epidemic in your county and beyond.
Well, thanks for having me, Rebecca.
And I also want to thank those who are listening to this podcast. I will share with them that we also have a webinar available where Kevin speaks, as well as Reb and Casey, or Dr. Close and Dr. Grover, that will be available. And that is a high-level overview of the Prescribe Safe Initiative. Additionally, as I mentioned earlier, I had the honor of interviewing Dr. Close and Dr. Grover on separate webinars, one looking at how they have used complementary and alternative medicines in this work, as well as a deeper dive into the collaborative aspects of this initiative. So if you want to learn more about this work and the other work that the AHA is doing to address the opioid crisis, please visit us at www.aha.org/opioids. Thank you.